everyone. My name is Professor Kylie O'Brien. Welcome to another of our Considering Cannabis podcasts. And I'm delighted to have Dr. Jake Felice with me today. He's a naturopathic doctor based in the States. He's a very charismatic speaker and social media expert on the topic of medical cannabis. He's also a part-time member at the faculty member at the Cannabis Institute of Seattle Central College. So he's done a lot of different things in his life. He specialises in the treatment of chronic pain in the clinic and improvement of human performance. He's a graduate of Bastyr University and former adjunct professor, where he taught advanced soft tissue manipulation and radiographic lab interpretation. So, Jake, I could probably fill up a phone book with everything you've done here. So I'm delighted to have you with us today talking about medicinal cannabis. But firstly, can I ask you a little bit more about your background and how you actually got interested in medicinal cannabis?
You know, every time I get asked this question, it comes out differently. I would say, since we are going to be discussing topical cannabis today a lot, the beginnings of that for me started back in Santa Fe, New Mexico, where I was. This was before I had gone to medical school, and I was attending massage school there in Santa Fe. And one of my classmates was a curandero, which is a traditional local healer. His family had been in the area for over 400 years. And he had told me, I had just taken a Mayan abdominal massage class, and we were comparing notes between an abdominal massage that his grandmother taught him and the similarities to the Mayan technique. So it was astounding to me, this kind of maybe a land bridge concept. He had also mentioned to me at the time that a lot of the traditional Mexican healers, the curanderos, used a topical cannabis product that was a mixture of tincture of cannabis and several other herbs, mostly for sore muscles, joints, aches, etc. And I think I filed that away in my memory bank. Years went by, and I, through my own practice, learned about cannabis and cannabinoid medicine, and something clicked, and I started researching topicals. I think topicals are one of the more underutilized forms of medical cannabis. They are far from perfect, but they have a lot of really great features that a lot of folks may really derive benefit from. Depending on the state, country, region that you live, the legality of topical products might be fully legal. In the US, they tend to be less regulated than conventional products because they fall under the cosmetic category. And my understanding is in Australia, you can't even get them at all, even if you are a licensed medical card holder. So I'm happy to discuss all of that. But for me, I hear from athletes all the time, and was just speaking with a former NFL athlete a few weeks ago who was telling me that the CBD oils and lotions are being used by pro athletes all throughout the states. And now there are certain regulations in place for cannabis testing that permit that to be the case. I think one of their most wonderful features is for injury recovery or post-workout recovery.
Okay, so let's explore that a little bit further. So it sounds like you're doing quite a bit of work with athletes. So you're talking about sort of using those topically for recovery, but
that's right.
Would you also say that using it internally would be useful too?
I think that it can be, and you know, as a naturopath, I kind of cross lines that conventional practitioners wouldn't. I personally get a lot of relief from topical products for pain. I don't get any relief from oral products. That includes oral CBD products.
Yep.
So for me, as you know, I still surf on a regular basis. I dabble with jujitsu. I beat myself up and don't really take as much care as if I had more time, I would be able to. I rely on the topical products a lot for my own recovery. So that's why I really, not only do I believe in a lot of the science behind them, I
Mm,
see them effective with my patients, with some of my colleagues. They're also effective for me. To answer your question, yes. There are cannabinoid receptors in the skin and local tissues, as well as
mm,
in the spinal cord and in the brain.
mm,
And when we use them and combine them together, I don't see it so much as a synergistic effect as an additive effect, but
mm,
usually with topicals, I've I've queried hundreds and hundreds of patients. It's about a 2 out of 10 on the pain scale that you get a relief from. And
mm,
that's independent of whether you're taking NSAIDs for
mm,
pain, um, CBD for pain. You get a little bit extra when you
mm.
use a topical.
Okay. So is the delivery system important? For example, you could just get CBD oil and massage that into the skin, or is it better in a cream base or in a patch? What tell me about the different delivery systems and what's advantageous?
The molecule itself is a lipid. It is going to cross the skin barrier. Typically, it is delivered in some type of a lipid format. If it's a cream, there may be some water or alcohol in there.
Mm-hmm.
What the studies show is that carriers can and do help enhance penetration through the skin barrier.
Mm,
You can, there are studies on alcohol, which is it's just a kinetic study, but you can
mm,
see that the CBD is pushed across more quickly.
mm,
I think other, depending on the regulatory status, may or may not be over the counter. DMSO can be a very helpful and effective driver. And
mm,
I also find that as a naturopath, castor oil is very, very effective. You would want to put the CB or cannabinoids on first and the castor oil on following.
mm,
The castor oil has its own anti-inflammatory properties, which are, again, like documented in peer-reviewed literature.
mm,
Um, so you can combine to enhance effects. There are also studies showing that ultrasound will also, if you're in a physical therapist's office or in a doctor's office, you can have the machine
mm,
with the pulses drive it in deeper. We do know that it crosses the skin barrier. We do know that at least in animal studies, it is getting all the way through the fat and into the muscle tissue. Um, and we know that the concentration is important, so that as a consumer, be aware of the total milligrams that you're purchasing. It is more about that in the price point than it is about the size of the tube or the bottle that the product comes in.
mm. Okay. So what's the state of play in terms of research? You just mentioned that some animal research, but what about in humans? Is there much research in this area?
Hardly any human research. There are 3 studies that I am aware of. One is a trigeminal neuralgia study,
Mhm.
which is a kind of a nerve pain in the face. Um, there is so much good animal tissue study on wound healing.
Oh, yes. Yep.
If anyone is interested, feel free to message me, email me, find me on LinkedIn. I'd be happy to send you the studies. Um, in humans, attenuates histamine-induced itch, so it is very effective for itch.
Okay.
There is another small human trial on pyoderma gangrenosum wound healing study. I
Okay.
think also very good for insect bites. There is super good indication for sunburn, not only the effect of the pain post sunburn, but also potential protection even after the fact of some of the UV damage. Again, these are in animal studies. But
Mm,
as far as the pain goes, I always
mm,
tell folks, judge for yourself. They do
mm,
not curiously, Dr. O'Brien, Kylie,
mhm.
curiously, they don't work for everybody.
Yeah.
But they do, I think, work for a significant percentage of people. I know that oral products work for a lot of people. They don't work for me.
Mm,
Um, but you can try it yourself. The effects are extremely subtle
Mm.
because even if the products have THC in them,
Mm-hmm.
you don't get a head high.
Mm.
CBD crosses the skin 10 times easier than THC does.
Oh, I
That
didn't
doesn't
know
mean the
that.
THC
Yeah.
as well as CBN. So um, uh, you want to make sure you're getting a highly concentrated product. And what I tell folks is to give your pain a number from
Mm.
1 to 10,
Mm-hmm.
apply the product, and in about 15 to 20 minutes, check and see.
Yeah.
Our nerve, because usually you do lose about 2 points on the pain scale, and our nervous system really does not alert us when the pain levels are going down as
Mm.
much as it does when they're going up. So if you don't pay attention, you could miss it and have a great afternoon and not even know that the cannabis was involved in
Yeah.
all.
Yeah. Yeah.
Yeah.
Okay. Now, what about other components of cannabis? Like there's a favourite terpene of a mutual colleague of ours, Dr. Philip Blair, who loves beta-caryophyllene. So what are your thoughts about beta-caryophyllene in things like pain relief topically, for example?
The CB2 stimulation in mice has been shown to be effective in neuropathic pain.
Mm-hmm.
I absolutely think it makes sense. I believe you're a Chinese medicine expert. I think a lot of the Chinese formulas,
Mm.
especially the ones that are hotter, will have some beta caryophyllene in them and really can enhance and work well with it.
Mm.
The beta caryophyllene enhances cell proliferation and migration, so that can be
Mm.
effective in wound healing.
Yes.
And at least according to one paper by Ethan Russo, beta caryophyllene has been shown to contribute to entourage effects.
Mm.
Other products that are non-cannabis products like copaíba oil,
Oh, yeah.
which is a Brazilian, probably grows in Australia too. It's kind of an earthy oil, has beta caryophyllene in it, and they have their own independent studies just on beta caryophyllene.
Mm-hmm.
So, and also very importantly, I think for neuropathic pain in shingles,
Oh, yeah.
no
Yep.
studies, on echinacea topically yet,
Mm.
but we do know the Southwest College of Naturopathic Medicine has done the pioneering research. If you read about echinacea as a CB2
Mm-hmm.
stimulator,
Yep.
as does beta caryophyllene,
Mm.
it's the alkylamides in echinacea that do this versus the terpenes
Mm-hmm.
with the BCP.
Yep.
But echinacea can be very good, say, for example, for shingles pain. And when a person has shingles, you don't, the area and sometimes the blisters can be so fragile, you don't put it on directly, but you
Mm.
can put it in a spray bottle,
All right.
and it can be effective that way. Also, CBD topically has excellent antibacterial properties, even at very low concentrations,
Yep.
and effective against very nasty microorganisms like MRSA, again at low concentrations.
And I've also understand that you were talking about wound healing before. Obviously, ulcers, leg ulcers,
Mhm.
maybe diabetic leg ulcers. Do you know much about the research into that?
I do not. I have been corresponding with a pharmacist in India who is working on that.
Right.
He was very skeptical, it seemed,
Yep.
about the cannabinoids, but I sent him the research, and I'm curious how he is going to. And he responded, and I think was duly impressed because it really is. I
Yeah.
mean, there's a deep, what phenomenal well of again, lower level animal tissue based studies
Yes.
on wound healing, and very few human studies at the moment.
Yeah. I guess that's probably the growth area then in terms of medicinal cannabis products, right?
I think on the pharmaceutical side, yes. I think in terms of more of the health and wellness side,
Mm.
just really for sore aches and muscles after
Mm.
a hard workout,
Yep.
for the insect bite, for atopic dermatitis, that itchy, We have
Yes,
poison ivy here, poison oak,
right.
poison ivy. I'm sure in Australia, you've probably got dozens of plants that will irritate the skin.
Yep.
Um, um, just really super phenomenal for that,
Right.
and good in post sunburn relief products as well.
Yeah, yeah. I guess that really that's one that I hadn't even thought of, let alone sort of heard much about. So now, you were talking earlier about how you sort of got interested in medicinal cannabis. So I'm interested because you're a naturopath, so you're a herbal medicine expert. For me, Chinese medicine always combines herbs. Don't usually use one herb on its own. So I think the reason I got fascinated with cannabis was its multitude of uses. It really is a fascinating plant. But the seeds were used, for example, in a Chinese herbal medicine formula called Mazharenwan, which was for constipation. That's just the seeds. But it makes me think that, at the moment, most of our focus is on medicinal cannabis on its own, but there must be surely a lot of opportunity to combine it with other herbs. And I'm not just talking about the terpenes, adding a bit more of a terpene, but other herbs, to develop some amazing products.
I absolutely agree, and it is one of the frustrating well, first of all, it's just a testament to the amazing diversity of the plant, and the molecule CBD in and of itself. I know your colleague, Dr. Blair, who you guys just published a book together. I think he has traced over, it's at least 25 different receptor systems that CBD alone is working on. So the plant in and of itself possesses potential for entourage effect. However, there's an old, and I have studied a small bit of Chinese medicine as a naturopath, but there was a saying is if you don't have a certain herb, there are others that can always fill the void in terms of supplies. I absolutely think we have an immense amount to learn from the Chinese pharmacopoeia in terms of how to combine, utilize, and even in these days test these multiple compounds. We used to not have the advantage of artificial intelligence and really sophisticated computer modeling that has now become very effective in looking at these combinations of these different molecules. But I am a big believer in the combinatory effects. The Chinese will discuss them as energetics in many ways, but I think those are all nuances of the various terpene profiles and the other. I just think that there are when I think of when I think of how many different types of cannabis products that could be formulated, it's mind-boggling to me that just the great array of options that we have.
Yeah.
And I regret that it seems to be going down a pharmaceutical route where really, to be quite honest, a lot of medical doctors and a large number of pharmacists really don't understand plant medicine, the pharmacognosy of it, and they are only beginning to get a glimpse of entourage through what's conventionally labeled as network pharmacology, which is utilized in cancer therapy and advanced neurodegenerative diseases. So I think that the cutting edge is onto it, but there is a culture that is stuck in the 20th century of single molecule, water soluble medicines, compounds that are very easy to control, very easy to test.
Yeah.
The plants, good luck, guys. I mean,
Yeah.
have at it. But the insights from traditional medicine have, to this date, come up with some of our best drugs, pharmaceutical
Yes.
drugs that we have today.
Yeah, and look, you can see that sort of reductionist sort of thinking, I guess, in the animal research, which is nearly all CBD or THC isolate. There was a very good paper published in 2015 by Galilei and his colleagues, and it compared, it was looking at anti-inflammatory and anti-nociceptive effects, and they compared a CBD isolate in a rat model with a whole plant medicine. And they found, either a U-shaped or a bell-shaped curve, depending on, whether we're looking at anti-inflammatory or anti-nociceptive in the isolate. But when they tested out the whole plant medicine, it turned into a linear dose response curve. And I thought, well, there you go, bingo. That shows you the difference very clearly on how an isolate acts, at least in that particular sort of model. And that study should be applied to many other, if you're going to use animal research, and look, I'm not a big fan of animal research, full stop. So, but if you're going to use animal models, well, you'd also want to do that in animal models of anxiety, for example, or depression and other different conditions, just to show that, look, there probably is a difference. And so you can't extrapolate necessarily results from CBD isolate to a whole plant medicine.
True, and that's a great example. When you have a bell-shaped curve, you're going to have a narrow therapeutic window. When that curve becomes linear by adding the extra molecules, you get more of a dose response type of a curve.
Yep.
There's other areas where synergy is apparent. There are 5 major mechanisms. Cannabis fits, and there's like you said, peer-reviewed data for all of the different methods. So even just one of those 5 methods qualifies for entourage or synergy. Cannabis possesses all 5. There's another very famous more on the naturopathic side, I guess, for plant lovers, of a malarial parasite. Malaria is a killer across the globe. And there's a Vietnamese traditional herb that is, I believe it's a chrysanthemum family. But there's one particular compound that is very, very effective against malaria. If you isolate it, like a CBD isolate it, you can use it and it is effective against malaria, but over time, the malarial parasite develops resistance to it. So if you've just isolated that molecule, down the road, you're going to have problems. But with this particular plant, there is another flavonoid that is a component of this plant that doesn't affect the malarial parasite at all if you use it as an isolate, no response. But when you combine the first with the second, not only do you get the positive anti-malarial effect, but over time, the malarial parasite does not develop resistance. So so these molecules do a large number of things that are almost non-intuitive, but now that we have a certain amount of insight with science and at really good advanced experimental design, we are starting to be able to peer into, and what it's really doing is it's not showing that plant medicine is better than single molecule medicine, but it is showing the advantages of using multi-target therapy to be able to use lower doses of the individual, for example, in cancer therapy, of individual, sometimes fairly toxic molecules, so that you're using less of them. You're still getting a magnified effect along with lower toxicity. I'd love to chat. We could take this wherever we want, Dr. O'Brien. We don't have to just discuss topicals, but I think that was a really good point that you made there.
Yeah, well, let's come back to topicals for a moment. Rheumatoid arthritis, quite painful for a lot of people. So do you use CBD in your practice?
It can be helpful. Rheumatoid arthritis is a tough one. It's an autoimmune condition. It will deform the joints of the hands, the feet. It's just really very challenging. As naturopaths, we always like to address immune hyperreactivity in the gut, making sure that there are beneficial gut flora, making sure that good, healthy fats are getting into the diet, omega-3s getting into the diet. I do find that a lot of folks with rheumatoid arthritis will get a prescription NSAID topical. There's no studies on this, but I think that the cannabis works real well in combination. We know that orally cannabis works great with oral NSAIDs, work real well with oral or even smoked cannabis.
Yep.
In fact, there's one study on smoked cannabis that reduces gastric irritation, stomach irritation from the NSAIDs. So back to the rheumatoid arthritis, study after study shows that patients utilizing medical cannabis reduce their utilization of other prescription medications. That includes NSAIDs.
Yep.
So it can help lower the toxic burden. And I just always will tell my patients, try it out, see if it works. If it works, great. That can sometimes either help in conjunction with their current pain protocols, or if they're
Yep.
taking something PRN as needed, they can choose to delay or reduce a dose. So I think it offers a lot of I also have folks, the hot wax therapy has some, there are some small studies showing its effectiveness in humans, but a CBD application before doing the hot wax,
So this
the
is
paraffin
topically,
therapy, topically,
yeah.
I think can be effective. Again, that heat can be a driver as well. So try it. But again, rheumatoid arthritis is a very challenging condition to treat. It's humbling. But I do see, at least for symptomatic relief, again, mild effectiveness with topicals.
So what skin conditions would you say you've found it tends to be most successful in?
I don't really use them for skin conditions, but I think that you could make arguments for eczema, psoriasis, atopic dermatitis, which is an allergic itch type reaction. There is some studies or indications with scleroderma, which is a kind of a collagen connective tissue condition. An old herbalist told me one time, dermatology, if the lesions are dry, moisturize them, and if they are wet or weeping, you want to dry them out. One of the things that cannabis and CBD can do, especially for dry conditions, is they can enhance the sebum production, which are the natural oils. So I think that they can be effective that way, but realize skin conditions can be very hard to treat. Again, skin is not really my area, but I always like to look at diet. And your patients, if you're a patient, and if you're a clinician, your patients will tell you, they'll tell you what they think their big faults are. And usually I like to try and work on one thing, whether it's be cutting out alcohol or wheat or adding a probiotic. The patients, to a large degree, this is an old osteopathic principle, will literally, they live in their bodies. They will a lot of the times give doctors clues. One great clinical pearl is, if you're in even if you're just doing counseling or coaching, one more thing I forgot at the end of a session, the one more thing that the patient forgot to tell you, that's a very important feature. So I try to pick, in an autoimmune condition, the body has turned against itself. What are some approaches that can help mitigate the attack of, it's kind of like a friendly fire death in war, turning our body's protective defenses against itself. Something has gone deeply wrong when that's happening.
Right. So you talked about, just mentioned before, about the importance of omega-3s in diet, and that comes back to sort of, I guess, feeding your endocannabinoid system, isn't it? So you tell us a little bit more about your approach with patients' diets and things like that, because I know with naturopathy, same with Chinese medicine, you come back to the root cause of illness and you come back to your basics. So I guess the gut is one of your basics, isn't it?
Absolutely. The gut, and because if you think about it, we're a giant donut. So from mouth through to the anus is all technically outside of the body.
Mm.
And so we are absorbing food through that tube as the food progresses through the digestive tract. So that is the outside of our body as a donut, encountering and dealing with foreign substances and bringing them in. That's exactly what the skin does on the surface. So about 70% of our immune cells are located in and around the gut tube. What do those immune cells do when they get alerted to foreign enemies, such as something that might be, I'm not talking about a food allergy, which is IgE mediated, but a food sensitivity, which is mediated through different immune mechanisms. You get an alert, they sound the alarm, they put out cytokines, the whole system gets on alert. And if it encounters something in the body that it doesn't like, it's much more likely to fire off. So that is one way to calm them down. You mentioned omega-3 fats. Our anti-inflammatory molecule are molecules that govern inflammation. When we eat omega-3s versus more arachidonic acid-based omega-6s in meat and processed foods, etc., the body's own inflammatory molecules become more calm, they become more sedated. And also our cannabinoids are built from our omega-3s. So our body will take those omega-3s to help the functioning of our own endocannabinoid system. We know that good healthy fats in the diet stabilize and tonify the endocannabinoid system, as does exercise, as does acupuncture, as does chiropractic type manipulations, as do other non-cannabis plants. So there are a lot of ways to address reactivity and inflammation. Inflammation is good in the first part of healing, but if it doesn't go away, it impedes the process. So that it is really chronic inflammation that is the enemy.
Yeah, that's right. Well, Jake, we started with topicals and we ended up with diet, which I always sort of think we come back to the basics: diet, exercise, stress reduction, vitamin D by getting out in the sunlight, and getting good sleep are your pillars of health. So I think that's a good note to end on. Look, I would like you to tell our viewers about your own podcast, because Jake has his own podcast, which is amazing to listen to, and I've actually been on it once myself. So Jake, just tell our viewers how they can link into your podcasts.
You can find me, Kylie, thanks for that question. You can always find me through just Googling my name, Dr. Jake Felice. You can also find me through LinkedIn. My website, drjakefelice.com. Interestingly, I'm going to be rebranding the name of my podcast. You can also find me through Cannabis Matrix. That has been my standard branding. But don't you know, one of the big, not PayPal, but another biggie, has turned off my ability to bill and collect. Even though I don't touch cannabis, I don't involve, and I've appealed the process. So I'm going to be rebranding. It looks like the new branding will be CT Matrix, but we are not fully decided on that. So in the meantime, you find me at my website or my YouTube channel, where I post all of the podcasts and videos. I have a whole plant approach. One of the things I do that not many other folks do is I talk about, why do these plants make these molecules? What is it about the endocannabinoid system that has enabled its ability to stay present through 600 million years of evolution? And I think that you'll get a much more holistic take on why this is such an important system, etc. I also have links to other podcasts such as yours here, Dr. O'Brien, that I've been on, and I'm just going to keep talking about this wonderful plant. And really thank you all for your time, and thanks for listening.
Yeah, thanks so much, Jake. It's amazing. I always learn so much when I talk to you, which is great.
Oh, likewise, absolutely.
Yeah. So look, viewers, We have, this is an ICCM production, the International College of Cannabinoid Medicine. You can find us at www.iccm.co. The ICCM was set up as an online learning platform for healthcare practitioners to learn more about medicinal cannabis. So we have over 55 educational videos there. Each has got a 10-question quiz, and you can download a certificate of completion at the end of it for CPD. So I'd encourage you to check us out at iccm.co. So again, thanks everyone for listening, and we'll see you at our next podcast.